Menstrual cycle or monthly period. Menstruation, also called menses or a period, is the monthly flow of blood from the uterus through the cervix and out through the vagina. About once a month, females who have gone through puberty will experience menstrual bleeding. Once a month, an egg leaves the ovaries and goes through the fallopian tubes to the uterus. At this time, the lining of the uterus thickens with extra blood and tissue to provide a cushion for the potentially fertilized egg. Every month, ovulation takes place, a process of releasing eggs from the ovaries. If at this time the egg gets fertilized with sperm, then the fertilized egg will attach itself to the uterus where it will slowly develop into a baby. However, if the released egg does not come in contact with sperm, the lining of the uterus and unfertilized egg will start to break down so that it may be shed. The cyclical shedding of the endometrium with an average period of 28 days is called a menstrual cycle. The amount of blood that comes out of the body is called menstrual flow. It's a combination of blood, mucus, and tissue from the uterus. When the woman gets her first menstrual period, it's called menarche, and the permanent stopping of menstrual events is called menopause. The brain, ovaries, and uterus work together and communicate through hormones to keep the cycle going. The menstrual cycle is the monthly series of changes a woman's body goes through in preparation for the possibility of pregnancy. The menstrual cycle typically has a duration of 28 days from the first day of menstrual bleeding until the first day of menstrual bleeding of the next cycle, but can range from 21 to 35 days. Although each woman has an individual cycle which varies in length, the average cycle is taken to be 28 days long and recurs regularly from puberty to the menopause, except when pregnancy intervenes. The length may vary from cycle to cycle and may also change over the years. Young girls often experience their first period between 8 and 15 years. This is called menarche. Usually, the bleeding is heavier on the first and second day. It gradually reduces over the next 3 days. The first day of the menstrual period is day 1 of your menstrual cycle. The average menstrual period lasts about 5 to 7 days and the amount of blood loss varies. A normal period may have these symptoms: cramps and lower abdominal pain, tender breasts, bloating, acne, mood swings, irritability, headaches, tiredness, and low back pain. Some months your breasts may feel tender when you have your period, other months you may notice bloating or mood swings. Every woman's menstrual cycle is different. Some women get their period at the same time each month, others are more irregular. Some women bleed more heavily or for a longer number of days than others. Keep in mind that menstrual cycle can also change during certain times of your life. For example, it can get more irregular as you get close to menopause. Use of certain types of contraception will alter your menstrual cycle, while on some pills you won't get a period at all. Pregnancy, polycystic ovary syndrome, uterine fibroids, eating disorders can alter the menstrual cycle and make your period stop. However, because the risk of uterine cancer increases as you age, discuss any irregular bleeding around menopause with your healthcare provider. Most of the time, an irregular or abnormal period is not serious, but you should call your doctor if you bleed for more than 7 days. You have a heavier than usual flow, your periods are shorter than 21 days or more than 35 days apart. You need to change your pad or tampon very frequently. You have skipped periods or your periods have stopped entirely. Your periods are irregular. You develop severe pain during your period and you bleed between periods. If you have these problems with your menstrual cycle or if you have questions or concerns about your menstrual cycle, talk to your healthcare provider. Thank you.